Welcome to Master Classes for Retirement Living, number 601. Today, we are working on Know Your Healthcare Options. So without further ado, let's begin. So we always like to do our introductions. Anne Frank, who is a marketing counselor, Barb Dull, another one of our marketing counselors, and Claudia Scheibel, our third marketing counselor, rounding out the team. I like to go through this section again, because we always have new people that have joined us for these master classes. So those of you that have been with us for all of the other ones, I apologize, but it does help us to remember why we're doing these classes. As we go through our life, we are really programmed early on in our time, and that would be with our schooling typically. So we go to preschool, we go to kindergarten, we go to school. We might take a gap year and then turn around and go to college or onto a trade school. And then we get a job, and we might have a family, we might get married, we might not get married, but life goes on and things really just perk along just fine until all of a sudden you've been working for 25, 30, 35, 40 years, and all of a sudden you have retirement looking at you and you have to say, oh my gosh, what am I going to do? So we're doing this series to give you an opportunity to envision what your retirement would look like. So we want you to think about, how do you want to live that retirement time? Do you want to travel and see new places and things? Do you want to spend time with your family members? Wouldn't it be great to have time for a hobby or a passion, such as painting or music or dance, that you haven't had time to do? How about participating in lifelong learning? We have many, many opportunities here in the Pittsburgh area for this, whether it be at a local library or at one of our local colleges and universities. Maybe you want to spend time giving back as a tutor, a docent, a coach, or maybe even a mentor. There are some of you that also say, I've worked all my life. I just want to eat, drink, and be merry. And that's okay too. So what might be holding you back from having that retirement that you want? Maybe the place where you're living isn't ideally suited for what you want to do. Your home may have been a wonderful place to raise your family and live all these years, but maybe it's outlived its usefulness for you at this point. Maybe you want to move to one level living and have it be a little bit easier. Maybe you're done with wanting to shovel snow and rake leaves and cut grass. And maybe you're done wanting to have to put a new roof on or install a new hot water tank. And if you're like many Pittsburghers, you may have lived in your home for 20, 25, 30, 35 years, and your neighborhood probably has changed during that time. Wouldn't it be nice to see friendly neighbors again that you can talk and have a nice relationship with? Maybe you've learned also, like many of us have through the pandemic, that we need areas to get outside and enjoy nature. It's just so settling and calming for us. And it's nice to think that we will have cultural events happening once again, and it would be great to live close to those. And as we get older or we experience pandemics, isn't it nice to know that healthcare is readily available for you also? So in prior master classes, we've talked about the best of the 4 H's for life plan communities. So they would include housing, healthcare, hospitality, and holistic wellness. We've covered the categories of housing and hospitality and holistic wellness already in prior classes, and today we're going to talk about healthcare. So healthcare options are many and varied today. This is so different from when our parents were retiring or our grandparents were retiring. Today we have what are called in-home providers, and you may know some of these names, such as Comfort Keepers, Home Instead, or Visiting Angels. They provide companions or nursing care for an hourly rate for as many hours as are needed. Someone, maybe somebody in the family, has to manage the needs with the services required and the attending costs. Some life plan communities offer at-home services. It's a contact that you make with this community, and you pay an entrance fee, and they then arrange for any health services, as well as managing house repairs or modifications that might be needed for you to remain in your home. You would pay that entry fee for each person that's coming in, and then you also pay a monthly fee. These fees are based on your age and the type of contract that you are signing. If you ever do need assistance to stay in your home, this organization would provide recommendations for you and act as a case manager for those services. Fees are based on the contract and on what services are needed and provided. If desired, you could move into the independent living community when you are ready, or you may wait until more care is needed and move directly to health care at the fee-for-service rates. Many varied contracts are out there, so be sure to ask lots of questions if you are considering this type of a contract. The third would be rental retirement communities, and those are springing up all over here in the Pittsburgh area. These communities give you the opportunity to stay in the same apartment. You can move into the community in either independent living or assisted living or memory support. They're all shared in that same building. There is no entrance fee, and the monthly fee reflects the amount of assistance required. Various pricing points are based on the needs that you have. If skilled nursing is required, the resident must move out of the community. There are such perks as dining, transportation, and activities available for you. Such communities do have licensed healthcare workers, but they are not inspected by CMS, which provides federal oversight. And CMS means the Center for Medicare and Medicaid Services. Instead, these rental retirement communities are overseen by the State Department of Health. One of the things I learned is that there are 45 inspectors for 1,211 facilities in Pennsylvania. So that means each inspector is required to investigate, do their inspections for 27 communities, whereas CMS has 115 inspectors for 693 skilled nursing facilities in the state. Those inspectors are required to do 6 per year. So you can see the amount of oversight is very different between a rental retirement community and a community that has oversight by the federal government. The last one that we want to talk about today would be life plan communities, and that's what we've really been talking about all along. It offers the full continuum of care, typically on the same campus. The ability to control costs is easier with a life care option, which many communities also offer. This gives you the ability to have healthcare services at substantially reduced costs from the general public. If you're a couple, one of you can go into healthcare and the other can remain in independent living. It's easy to visit and dine between the two areas, and long-term care insurance can be used in healthcare along with a discount for being a resident of the community. This would again be fee for service. So again, you want to ask questions when you're out looking for your community because every community is different. One other question you want to be sure that you ask is what kind of rating does the skilled nursing component of the community have? As I said, CMS, the Center for Medicare and Medicaid Services, gives a rating each year, and 5 stars is the top rating that you can have. There are also ratings compiled by magazines ranking all skilled nursing communities by the region. I'm happy to report that Providence Point actually is 5-star under CMS, and we are rated as among the best performing nursing homes based on the surveys done by US News and World Report. Here is a report that I pulled that Genworth does every year. So this is an item that's called the cost of care. And you can see that I have pulled for the state of Pennsylvania because that's where we are. And the most current one they had online was the 2020 costs. So if you were considering one of those first items like the home instead or the visiting angels, those are what they call homemaker services. And that would be, you can see a charge monthly of $4,576. And that would be based on 44 hours a week for someone coming into your home to provide services that you've asked. And you can see a homemaker health aide is coming through at the same price. One other item we really haven't addressed in any other areas is adult day health care. There are communities that are out there that do this, and it's based again on an annual cost divided by 12 months. And you can see that you would provide the transportation to get your loved one to an adult daycare setting, we call it, and you would have them there for a set number of hours each day to give the caretaker the ability to have some time off. Next would be an assisted living facility. A private one-bedroom would statewide cost $3,955. And again, this is based on the entry level of care. Typically, most communities have 3 or 4 levels of care, so that price goes up the more care you need. And the last is the skilled nursing care that's available. In a semi-private room here in the state of Pennsylvania, the average cost is around $10,038, and a private room is $10,828. And again, I'm going back and talking about life care that you get when you're in a life plan community, and that skilled nursing cost would be only $5,087 here at Providence Point, based on our weighted average for life care residents. So you can see the value of moving into a life care community immediately, because you have all of these items available to you except the adult daycare, but you have them there as a full continuum in the community where you move, and you're not having to move in the midst of a crisis if your health changes and you need skilled nursing. So here we talk again about life plan communities offering independent living, where the residents enjoy lots of amenities, dining venues, housekeeping, transportation services, events, wellness activities to enhance their lifestyle. Personal care or assisted living, we've talked about that. It's for the person that needs help with activities of daily living, they call it. So it can be medication management. They may need help with bathing or dressing, meal preparation. And as I said, there can be 3 to 4 levels of care that come in under those types of living. Memory support is for the person that needs assistance with the same items above on daily living, but they also have cognitive challenges. This area is usually secured to assure the safety of the resident, because again, one of the things with cognitive issues is people become confused and they tend to wander. So that's a very important thing to know when you're looking also, is there a dedicated memory support area for your loved ones? Skilled nursing, again, is for the person that is no longer able to do most activities of daily living, and they need a lot of support. So one of the other questions I'd like you to ask when you're out looking at communities, what is the philosophy of the healthcare center that you're looking at? There is a new philosophy that's been out here for a while now, and it's called person-centered care. And what that means is it's not so medically directed, it is more like your home. So questions you might ask are there flexible hours for dining? For example, can breakfast be at 7 o'clock, or can it be delayed till 9? Are there choices available for each meal, or is there an entree and that's your choice for the meal that day? Is the same team providing care and assistance for the resident, or are there lots of different people flowing in and out of the skilled nursing room, causing maybe some confusion? It's nice when one person acts as that major caregiver for the person. It can be the resident aide that helps, and you have a consistency with the nurse that stops in, because the resident gets comfortable with the people that they know. Another question you might ask is, are electronic medical records utilized? It's a great way for charting to make sure that the proper fees are charged and billed and paid by your insurance companies. And also, usually attached to that electronic medical record is a photo of the resident. So if they are receiving medications, the med tech will know that it is the person that's supposed to be getting these medications, because they can see a picture of them in their file. Another question that you always want to ask too, is there a dedicated physical therapy suite for rehabilitation exercises? You know, it may be that somebody comes in and does a little bit of work in the room itself, if there's enough room to do that, but it's really nice to have the chairs and the bands and the weights and all the things that go along with bringing somebody back to their former state, if that is at all possible. And the other thing would be to ask, are there engaging activities for all levels and abilities for the residents? It's nice to have things to look forward to, whether it be entertainment, whether it be a class that they go to, an art class, or a reading story class time. And the other really important thing, again, that we've learned is outdoor spaces are really important for all of us, even the folks that live in a healthcare setting. Can they see an area that's full of beautiful flowers? Can they get out and sit in a courtyard? That's another thing you want to check and make sure is available to them. All healthcare rooms are different. Here is a picture of Providence Point. And I show this because I think it really shows that it's comfortable and it looks somewhat like home. It has crown molding, it has uplighting, it has sconces on the wall. You can see that little bookcase there along by the window for shelves to display favorite things. There's a window seat for extra people that might be visiting. And underneath that is storage. So you can have supplies and things that are needed for your resident right there. And again, you'll note that the furniture does not have that medical institution look. It looks more like a residential setting. So those kinds of things are very important to the person that spends their days there. Are the meals ordered from a menu and served at the table in the dining room? So on the left, I've shown a picture of our skilled nursing living room to the front of the picture, and then dining rooms at the back. So you can see they have tablecloths, they have nice wooden chairs that pull up, and food is brought to them by servers. On the right is the personal care dining room to the forefront, and the living room is there towards the back of the picture. So again, it looks very residential. It's very comfortable, and people are usually very comfortable in that type of a setting. Memory support is, again, another area that you want to be sure that people are comfortable there. Notice through those windows to the right, there are chairs outside in the courtyard where people can get outside during nice weather, and it's a secured area. So again, they can wander around safely in that contained space. Behind the half wall in the back, you'll see that there is a table there that they can dine family style. And to the left of that is a nice area where it's like dining at home. Staffing includes registered nurses, licensed practical nurses, certified nursing assistants, medication technicians, aides, housekeeping. Lots and lots of people are responsible for making sure that your loved one is safe and secure. You can also see to the right of the four ladies that are there coming in their scrubs is the receptionist, Mary Ann, and that desk is manned 24 hours a day so that people can come in after hours if there's an emergency, if someone has to be brought back from a hospital visit. We know that there's always someone there waiting and welcoming them. Here at Providence Point, our assistant director of nursing has also taken on the duty of being the infectious disease control coordinator and has also coordinated all of the vaccinations that have been received by all of our residents that live in the entire community. You've got registered nurses or dietitians, social workers, activity coordinators, so lots of people. So many people think that staying in their home is just the best thing ever, but as you get older and less mobile, you really become almost a captive in your home, and you're only seeing the person or two that might come in every day. Where here you're going to have, there'll be people, there are things going on, people saying hello, they can talk to other residents that live here. It's really a nice atmosphere. Our residents love the staff members. We have a lot of staff members that serve that are high school students. And so they love talking to the kids. They feel like they're their grandchildren, and they really do develop nice relationships. The aides that serve become, again, another part of the family. The family comes in and visits, they talk with the aide, they get to know some of the quirky things about their parent, or that's how they always have been. So it's nice to have that person become a part of the concentric circle that is taking care of the loved one that's in the community. Of course, we always have daily attention to grooming if it's needed. There are care plans that are done with the family on a quarterly basis that affords you the opportunity to meet with social workers, therapists, nurse, dietitians. It depends on, how your loved one is thriving in the community. So it's always good that you can have input with that also. The other thing I do want to say is our staff and residents do participate in many different ways to raise funds for research for Alzheimer's disease is one of the things that we do on an annual basis. But we also take up collections for gifts for all of our residents that are in our healthcare center also. So it's a very caring group of people that are here. And I thought you might like to see some of the activities and events that go on. Staff also comes in annually with their children for trick or treat in the personal care and skilled nursing areas. And obviously, these are all pre-COVID. Family members can also join in on the fun when we have musical events that are presented. And again, everybody loves seeing their loved ones happy with a big smile on their face. And that's what we attempt to do, is to keep them happy. And we, of course, celebrate milestone birthdays with awards and proclamations. These two ladies are 100 years old. They look fantastic and still are out and about and doing lots of things. So today's takeaway, when you're doing your research and searching, you want to make sure that if your health would change or an emergency happens, do you and your family have a plan in place? It provides great peace of mind to everyone. So this is a way of having a plan in place in case something does happen. You also want to ask about private rooms and private baths being available for your comfort and well-being. Are there varied menus available for choosing from? And is it the food served to you at the table, or are they all served in the rooms? And are there appropriate enriching activities available for your loved one that might be in this area? And what are the federal and state ratings when you're looking at a community? You can actually go online and get that information also. And the other question to always ask is, if you do have long-term care insurance, is it accepted at that community? And the other question you want to ask is, if you're coming in through independent living, is life care available so that you can help control your costs a little bit? If you have any questions, please feel free to give us a call. That's why we're here.